Good evening. Thank you so much for watching HealthLine on PBS Fort Wayne. I'm your host, Mark Evans. Tonight, a subject I've never covered before. I'm not even sure if we've covered it on HealthLine in general over the last 20 or so years the show's been on the air. But we're talking about penicillin allergies. You'll be surprised about how many people in the United States actually have it. It might even be a relative or a friend of yours. Phone lines will be open, 866-969-2720. Call anytime in the next half an hour. We'll intercept your call. And we don't stop down for commercials because we are public television, so we'll get to you as soon as possible. Please call to ask those questions to be answered. Our special guest tonight, he's been on the show before. In fact, we talked about HIV and AIDS about a year ago, wasn't it, Doctor?
Yeah, that's correct. It was about, I think, June of last year.
Okay. Well, it's great to have you back. It's Michael J. Davis. He's a DO, Doctor of Osteopathic Medicine, and he's also has a master's in public health. So it's great to have you here on the show.
Yeah, it's a pleasure to be back.
Great. And you did a great job last time when we had several phone calls, so let's hope that those phones will light up with more questions for you. You know, I've received sometimes some helpful hints from the doctors as far as what they would like to talk about on the program. I did receive lots of information from you, so thank you for that. You also mentioned in that information that penicillin has been a hot topic at a lot of infectious disease conferences lately. Why is that?
Yeah, so penicillin, it's been a hot topic because what we found is there's a ton of people that are labeled as having a penicillin allergy. But in reality, we probably don't have that many penicillin allergies among the public that we really think we do. Oh. And people may be actually mislabeled and receiving worse antibiotics than they really should be getting.
Okay, and as I mentioned at the top of the show, you might be surprised that there are more people who have it than not. But apparently they are finding some situations where, no, you really don't have a penicillin allergy. Well, and that's one of the reasons I guess we're doing the show, so we can decipher the difference. That's great. So let's just get started. First of all, Alexander Fleming pretty much discovered this antibiotic. Can you give us some history about penicillin and what it's actually used for?
Yeah, so the history of penicillin is actually quite fascinating. So, and this goes back to the 1920s when it was first actually discovered. I think it was 1928. We just came out of World War I. We didn't really have anything to treat these battle wounds for these soldiers coming from the war, and a lot of people were dying from infections from their wounds. And so Alexander Fleming, he was working through World War I, came out of the war, and his first goal was, I gotta find a better way to treat people than just putting antiseptics on the wound and hoping for the best. And so he really took this back to his lab back in London, and he was trying to study different molecules to try to find a way to treat these infections. And he actually discovered this on accident. Penicillin. One night, he got tired. He had a petri dish of the bacteria Staph aureus, or if you heard of staph infections. And this bacteria was on the petri dish. He discarded it, came back the next morning, and there's a mold growing on this petri dish. And he's like, what the heck? And when he looked at the petri dish a little bit closer, he saw that the bacteria was actually being killed off by this mold. And this mold that he discovered that was killing the Staph aureus on this petri dish was a mold called Penicillium rubrum. And through more discovery and testing, he found it was actually secreting a molecule which he now termed penicillin, which actually kills bacteria. And this led to this huge explosion of antibiotics afterwards. And penicillin really became the wonder drug. It was saving lives. And they've been able to adapt it through time to a bunch of different formulations, to things like amoxicillin, ampicillin, which are probably the most common ones that people actually hear about. But even ones that people don't hear about that target things like staph infections, strep infections, or even people coming into the hospital that are coming in septic and we need an antibiotic that treats very broadly. Something called piperacillin is probably one of the most prescribed antibiotics when you come into the hospital.
Wow. Yeah, and I was going to ask you, in fact, you just touched on it there briefly about the fact that there's more than one type of penicillin antibiotic. How many do you think that there are?
Yeah, so there's probably about 6 or 7 that get used nowadays. So we have our basic old penicillin, which still gets used today. It's good for things like strep infections and syphilis infections, which, there's been a syphilis epidemic in the United States, and that is our main go-to drug.
Wow.
We have amoxicillin, which most people have probably heard of this one. You get strep throat as a kid, it's amoxicillin that you're getting. And it was a penicillin that's really targeted towards, strep. Also good for things like sinusitis, skin infections called cellulitis. Those are kind of the big things for amoxicillin. Ampicillin is a common one we use in the hospital for certain pneumonias. And then there's other penicillins that have been adapted to treat staph infections, which people probably don't know about these as much because they're mostly used in the hospital. Things like nafacillin, flucloxacillin, oxacillin, a lot of cillins here. And then our big gun, piperacillin, which we use when people come in with sepsis.
Oh, wow. Okay. Well, and those are all wonder drugs, like you mentioned, but there are people out there who have allergies against them. So how common is the allergy for any type of penicillin type drug or antibiotic?
Yeah, so there was a great review that covered this topic in about 2019 from the Journal of the American Medical Association, or JAMA. And they estimated that about 10% of the United States actually has a label of a penicillin allergy, which, that equates to, like 30, 32, 34 million people across the country.
Wow. So, with that said, why so many? Is the penicillin allergy genetic? Are people inheriting this?
Yeah, so that's a good question, and we get that question a lot when we see people in the office. I don't know that there's a lot of great data to say that it's a genetic thing. But what we do see is a lot of times people get penicillins, early on in life, especially as a kid. And when we're growing up as kids, our biggest fear is, getting a bacterial infection, and so antibiotics may get overprescribed in some circumstances, and so people may actually get a reaction to the antibiotic just because they have a virus going on instead.
I forgot about that particular antibiotic can be overprescribed. When did they discover that? You have this wonder drug that's a wonder antibiotic that's been rolled out, and I'm sure they were using it like crazy, especially after that war, to fight off a lot of infections. So they found the adverse, that you can probably get too much. Yeah,
and that's the interesting thing, and kind of the reason why some of these changes in the penicillin molecule have happened is because penicillin was a wonder drug. You give it to everyone when it first came out. But as we give more antibiotics out, what we find is the bacteria actually learn to adapt. They develop resistance to antibiotics, which has probably been one of the biggest issues across the country right now. There's new bacteria that are coming out that are resistant to every antibiotic that we have available in our arsenal, which makes things very challenging.
I know when I get an occasional sickness during the wintertime, and it is actually conducive to get an antibiotic, sometimes they withhold that because I already had one maybe the year before, or maybe not too long ago for something else, and they said, we're just going to skip on the antibiotic this time.
Yeah, and it's a very common scenario where, it's probably where antibiotics get prescribed the most is respiratory infections.
That's exactly what it was. So does it make it worse, or it just gets to the point that it doesn't help at all?
Yeah, so the more you get exposed to antibiotics in life, the more your bacteria learn to resist them.
Right.
And so it gets worse in that you have to use other antibiotics to treat it, which may be more toxic and may cause other issues and drive more resistance down the road. Yeah.
So what would be the best thing to do? Just wait it out for a while and try other things for that patient? What would you do in that situation, you as the doctor?
So a lot of times, what we've kind of noticed is, with these respiratory infections, it doesn't usually start off as a bacterial infection. It commonly is a virus that triggers this. And so usually I say, if you're just having some low-grade fevers, kind of wait it out for the next 7 days. But if it starts suddenly getting worse, that could be a sign that you're getting a bacterial infection. Because a lot of times what happens is these viruses, they infect you, they actually lower your immune system and damage some of the tissues in your respiratory tract, so your nose going all the way into your lungs. And that really sets the stage for bacteria to start causing issues and causing infection.
So penicillin doesn't do anything for viruses then?
Yeah, so antibiotics, they don't treat viruses. The treatments for viruses are actually very, very few. The antibiotics really are just for bacteria.
Interesting. So what are the symptoms or the allergic responses a patient might have if they're allergic to a penicillin type of antibiotic?
Yeah, that's a great question, because this is where people struggle to define what is an allergy. But classically, a true allergic reaction to an antibiotic is, you get the antibiotic, and then usually it's within an hour actually that you start developing certain symptoms. Most commonly, you might get some itching, you might get some rash, you might feel short of breath. The more severe reactions that we look out for, and that can be life-threatening, are things like anaphylaxis, where your body just goes into overdrive and your blood pressure starts dropping, and it's almost like you're getting septic.
And I noticed that on some other notes here that if you have that, you need to see a doctor right away. You probably need to go to the emergency room. In fact, they're even advising here on this from the CDC to call 911 because it could be really serious.
So anaphylaxis is very serious and it is life-threatening. And I think where people see this more commonly and hear about it is with things like bee stings or peanut allergies, where you prescribe an EpiPen because it can lead to those kind of reactions.
So you've told us about the responses and symptoms. What about the long-term impacts of a penicillin allergy? What happens then?
Yeah, so what we know with these penicillin allergies is, I'd say a lot of them, are low risk, are non-severe reactions that people have. Things like a delayed rash after like 4 or 5 days, or some nausea. Those are kind of the common things that we see. But what we know is about 95% of people that have those kind of low, those less severe reactions actually probably still can tolerate penicillins fine. And even those people that have an allergic reaction, within an hour of getting administered the antibiotic, about 80% of those people will lose the allergy over 10 years. And so a lot of these people that are diagnosed with a penicillin allergy early in life, they may not actually have the allergy anymore.
I was going to ask you if you can outgrow it, so to speak, a penicillin allergy. You just answered that question. So I don't know, that's kind of good news. So you have to get tested, I'm sure, by an allergist or an immunologist to realize that, and to realize that you are allergic to penicillin. So what are the testing procedures?
Yeah, so the testing procedures, it depends on how severe the reaction was. So for some of these more minor reactions where, may have been a rash or some itching, maybe some nausea, we can really just go to giving you a dose of amoxicillin and watching you for an hour. So the typical procedure is, you come into a clinic, usually it's gonna be an asthma or allergy, or an allergy clinic, sometimes infectious disease clinics too, because they've been picking up the mantle on this as well. And they check your vitals, give you a dose of amoxicillin, and then they monitor you for about an hour, because that's about the time frame where you should get a reaction if it's a true allergic response.
That seems like it's fairly fast.
It is. So it should hit you pretty quick.
Okay. So what are you going to be experiencing if that backfires on you, so to speak?
Yeah, so
what would be the symptoms or the responses?
Yeah, so in these low risk situations where we give the amoxicillin, the thing I usually tell people to watch out for is, let me know if you have any kind of rash, itching, if you feel like your mouth is swelling up, your face is swelling, you're getting short of breath, and then also, we're going to watch your vitals, but if your heart rate starts going up, those could all be signs that you're having an allergic reaction.
So it seems practical to me if you didn't know if you had a penicillin allergy or not, and I know because I just went to the doctor recently, pardon me, one of the first questions they ask you during the pre-screening before the physician comes in, what are your allergies? Of course, mine are all listed in the system. Codeine is one. I just can't do codeine. That's it just makes me very, very sick. So luckily, that's at the top of the list. I make sure they know about that when I go in. Had a bad experience with that. But they seem to be very interested in your past history. But my question is, if someone had never really had a reason to have penicillin before, and they might be scared, they might even have seen this show and say, oh, I better ask about that next time I go to the doctor. Would it be practical to do a penicillin type test before you actually were given a full dosage of it?
Yeah, that's always an option. And I'd say with no history of a reaction, typically, we can go to an amoxicillin challenge is what we call it, where you take a dose. But, for people that have more severe reactions in the past, sometimes what we'll do is we'll be a little bit more cautious. We'll actually do skin testing. It's it's basically what's involved with that is it's a couple pricks on the skin, and they actually put a little bit of penicillin on one of those spots, and then they have a test site and a control site to see if you're actually having a reaction. And if you're not having any reaction, then they kind of proceed to doing that amoxicillin challenge.
If you wanted that done, I mean, is it okay to bring that up to the doctor? Can we test it out first? For instance, long story short, I'm not allergic to penicillin, but my brother is.
Okay.
And so is my grandfather on my mom's side. That's why I was asking if it might have been inherited. So if you have a family history of that, that probably wouldn't be a bad idea to test it out if you've never had penicillin before.
Yeah, it definitely would be reasonable to go ask your doctor and see if you can get checked and potentially go through the testing.
Okay, very good. That's good advice. So you talked about a little bit about what happens when you go in to see the allergist or the immunologist, the skin test. It doesn't sound like it's that big of a deal.
Typically, no. If the symptoms you're typically going to have with a skin reaction is usually some itching, some swelling at the site, which might feel a little uncomfortable. Those are probably the big symptoms you'd get.
It sounds like it's a cinch. It wouldn't be a big deal. I'd rather be safe than sorry, to be honest with you.
Exactly.
Hey, we've got a call coming in. Got Wesley on line 5. Actually, he's asking for us to read the question, which we'll be more than happy to do. He's asking, I used to have a sensitivity to penicillin, and my doctor told me that I had 1 to something sulta antibiotics as well. Is there a connection between the two? Do you know what he's talking about there?
Yeah, so that's a good question. So sulfa antibiotics
okay.
are also a very common antibiotic. Also a lot of history behind that one as well. We won't get into that. But it is another one that we commonly will see allergies to or reactions to. I wouldn't say that there's a connection between penicillin allergies and a sulfa allergy. They're different. And even you'll actually see sulfa within a lot of other medications beyond just sulfa antibiotics as well. So no real connection there. But there are some good testing guidelines for the penicillin. The sulfa testing, that's something that's still being explored in the allergy space.
Yeah, I think they should maybe spend some time on that. We are talking to Dr. Michael J. Davis, who is a doctor of osteopathic medicine, and he is a specialist when it comes to allergies, penicillin-type allergies. And you do a lot of presentations at conferences and so forth, and you said you know this information like the back of your hand, which obviously you should as a doctor, but we appreciate you sharing that information tonight. And Wesley, thank you, by the way, for your phone call. We still have about, I'd say 7 or 8 more minutes. If you have a question about penicillin allergies, the telephone number is on your screen, 866-969-2720. So, Doctor, if and you touched on this before, but I want to make sure we talk about this before the show ends. If I'm allergic to penicillin, but I have an infection where only penicillin will work, what do I do? What are the safe alternatives to that penicillin?
Yeah, so that's a really good question. So penicillins are our first-line agents for, I'd say, the vast majority of infections. If you do have a really bad penicillin allergy, there are other options available. We do have some other safe antibiotics to use if you do have the allergy. I'd say a very common class of antibiotics that we end up using are things like cephalosporins.
Never heard of it.
So if anyone's ever heard of Keflex,
that I have,
which is a very common one that we use for skin infections and a bunch of other indications. Those antibiotics don't really cross-react with the penicillins all that much. It's very low, like less than 1%. So those are very safe antibiotics as well, but also very similar to penicillins.
And why wouldn't you use those in the first place to perhaps skirt any penicillin allergies?
That's a good question. I'd say in the immediate situation, a lot of times we will. We'll just go to the cephalosporins because they are safer. They're safe antibiotics as well. But in the meantime, we do want to make that to get rid of that penicillin allergy if we can, or figure out if it is truly an allergy, because there are some cephalosporins that might interact or might have cause a reaction similar to penicillin, and so it does limit the options of the cephalosporins to some degree.
And you say syphilis, but I'm going to talk about syphilis right now. The
Yes.
Keflex, is that how you pronounce it? Am I pronouncing that correctly?
Keflex, yep.
Okay. Does that fight syphilis?
So Keflex, no.
Oh.
So there's actually only one drug that has the indication to treat syphilis.
And it's penicillin.
It is penicillin. And so, this has been a big issue over the last few years as, syphilis, it's been an epidemic recently. And we actually had a penicillin shortage recently over this last couple of years, and so we didn't really have a lot of great agents available to us. And so a lot of doctors across the country were trying to come up with other regimens and testing out different regimens. And hopefully we'll see the data come from that to see, what other options we have. But right now, the only main drug we have is penicillin.
Okay. Do I need to avoid any other drugs if I might be on another drug type protocol for being treated for something else? Do I need to avoid any other drugs if I'm allergic to penicillin?
That's a good question. So I would say no. There's not a lot of cross-reactivity with penicillins and other medications. You do see it with other antibiotics, though. So the question from Wesley earlier, sulfa antibiotics, that's a good thing to know because there is some cross-reaction to things like people's blood pressure medications or water pills. There are some cross-reactions there, but penicillin, not typically.
Okay, and if I do have a reaction, and it was anaphylaxis, you're the doctor, not me. If I had that, or any other type of reaction to penicillin, those pens, what do they call those? Those
EpiPens.
EpiPens. Should I carry one of those around just in case, or have one in my car, or at least available? I mean, would they work?
So that's a good question. So EpiPens, epinephrine is the treatment for severe allergic reactions of any kind. So most commonly you're thinking about bee stings, peanut allergies, good to carry it for that. Typically with penicillin, you're going to be taking penicillin, and most people, if they've had a reaction, usually they're having a reaction in a controlled setting. And in those controlled settings, we usually have epinephrine on hand just in case.
Okay.
And so I wouldn't say you would need an EpiPen unless you already have a documented penicillin allergy.
All right, and that's something maybe you should talk to your physician about, just to have a backup system. There was a question regarding a patient's chart. I think that you wanted me to ask you something about the making sure that you, or if you're a parent, making sure that that is documented. I told you about when I went to my doctor. Well, my allergies are right there. That's very important, isn't it, for parents to tell the doctors, especially if they don't have any medical records available. They got to get in there and tell that doctor that, hey, by the way, I think we've got a penicillin allergy here.
Yeah, it's definitely a good thing to let your doctors know, and hopefully your doctor, when they hear this, they'll do a little bit more digging and really try to sort out, is it a true allergy or is it more an intolerance? And hopefully then, if it sounds like a true allergy, hopefully they're getting you connected to an allergist or an infectious disease doctor to really explore and see if it truly is, and potentially do some testing. Because you do want to clarify whether it is a true reaction, because you don't want to develop severe reactions like anaphylaxis or things like angioedema, which is a fancy word for face swelling, which can cause respiratory distress. But it's a good thing to let your doctors know about.
Very good. Listen, the floor is yours. I always call this section of our program Doctor's Notes. So what would you like to leave our listeners or our viewers with as far as any advice when it comes to the penicillin and reactions or allergies?
Yeah, so I think the big take-home message is, there's a lot of people that have a documented penicillin allergy. But what we know is a vast majority of people probably don't have the allergy anymore. And so I would say, explore this with your doctor, talk to them about it, and, maybe ask them, should I get tested for this? So that if I do get a severe infection down the road, I have the best antibiotics available to me. Because inevitably people will get infections at some point in their life, especially as we age, and we want to have the best antibiotics available to you. It'd be nice to try to stay with these antibiotics that are proven, safe, and effective, and try to avoid some of those more toxic antibiotics that may actually have black box warnings on them, and may actually drive more antimicrobial resistance, which has been a big issue across the country with super bacteria.
All right, and of course, if you have any questions, please ask your physician. Ms. Floor Director over there in the distance, how much time do I have? We've got 1 minute. I do want to ask you one question before we wrap up. You primarily deal with adults. If you don't mind, let's go to the line, across the line here for pediatric medicine.
Yes.
Do antibiotics react differently with children versus adults? Is there any type of difference, or is there anything that we should look out for when kids have antibiotics like penicillin?
Yeah, so that's a really good question. I'd say, we're very quick to jump to say that it's an allergic reaction for kids, but really there's not a lot of difference there. The symptoms may be a little bit more different and a little more severe. Things like some drooling in the mouth would be a little bit more common with children because they have smaller airways. They may respond a little bit more severely initially. But from a reaction standpoint, typically you shouldn't see too many differences as far as how often they happen. I'd say the big things, is that probably the allergy gets overcalled because we're overcautious with kids. When in reality, it's probably a virus that's probably causing some of the rashes that we're seeing.
All right. Well, thank you very much, Dr. Davis. Really appreciate the information tonight. I learned a lot just talking to you, not only just doing some research for the show, but lots from you, and we appreciate it very much. Please come back.
Yes.
Maybe next year.
Yes, I've been happy to be here.
All right, thank you. Thank you, by the way, for watching and for your questions coming in. We'll be back next Tuesday night with another very interesting show called HealthLine here on PBS Fort Wayne. Until then, thanks for watching, good night, and good health.
PBS Fort Wayne was made possible in part by
Cancer Services of Northeast Indiana, walking side by side with families on their cancer journey, providing emotional support and practical assistance for yourself or another. cancer-services.org. Momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.